Addendum Chapter 12.2. The lockdowns harmed babies. Lockdowns caused developmental delay. There is no shortage of things to be outraged about involving the lockdowns. Here's another. Babies born in 2020 during the lockdowns were found to be developmentally delayed at 6 months of age compared to those born in 2017. This was caused by the lockdowns. The paper that brings this to light is Shuffrey et al., published January 4th, 2022 in JAMA Pediatrics. The authors had the hypothesis that maybe babies whose mothers contracted COVID during pregnancy would be worse off than those whose mothers did not. But they found there was no significant difference between those groups. However, then they compared all babies born between March and December 2020 at 6 months of age with babies born 3 years earlier in the same hospital. And of course, they controlled for age of mothers, educational level of the parents, and ethnicity. So the two groups were similar in all those measures. There was a big and highly significant difference in the developmental scores of babies born during the lockdown period with those born previously. The 6 months olds born during lockdown scored about 10% lower on gross motor, fine motor, and personal social skills than babies born pre-COVID. And all those differences were highly significant. P-value less than 0.01, meaning less than 1% possibility the differences were due to chance. Communication and problem solving were not significantly different. Why would this be? It is not because of COVID, since there was no difference between infants of infected mothers and non-infected mothers. It also was not caused by the vaccines, since these babies were born before COVID vaccines were available. I suspect it was a combination of two factors caused by the lockdowns. One, depression and unhappiness of the parents, making them less playful and engaged with their babies and therefore less effective parents. And two, mask wearing, perhaps by the parents and certainly by daycare providers. The parents and daycare providers and grandparents and others who interacted with the babies during the lockdowns were more depressed and unhappy than parents in previous years, and for that reason they were undoubtedly less effective parents. They were moping around and not cheerfully playing with their infants as much as parents in previous years. Second, daycare providers were mandated to wear masks around babies, and parents were encouraged to. As a result, it was harder for the babies to hear speech, to see mouth movements that correlate with speech, and to see facial expressions. So naturally, they would have a harder time learning language and learning emotional expressions of humans.